lose 10% of my weight before I had my weight loss surgery. And I had to do a 24-hour liquid diet before weight loss surgery, and that was in 2012, September. It was about a 9-month waiting period for me. It was a medical supervised diet with a nutritionist I met every week. I had to keep at the time there wasn't My Fitness Pal or anything. I kept it in a journal. And this is my original journal that I kept. Usually I have 1, 2, 3, I have 5 journals in 7 years. And I write different stuff in it. And the first one was Live Life in Color. And my next one was Dream the Impossible, Seek the Unknown, and Achieve Greatness. And then another one, and this is my other one right here. This one says Determination, My Body is Not a Trash Can, Manifest Your Destiny, and Racing Ironman. That was when I would train for 3 years for Ironman, triathlon sport. So yeah, today I want to talk about fatty liver disease. And what is that? Well, the thing about it is it's really it's silent. Some people don't even know they have it, right? Until it manifests itself, and then it comes up on a blood test, and that's when it's really critical. But one thing about the liver is that it can regenerate. That's probably one of the only organs that can regenerate itself. And it can take a lot of beating because it's a filtration system inside of the body. The fatty liver disease, according to the National Liver Foundation of America, AmericanLiverFoundation.org, 30% of the population has fatty liver disease because obesity is on the rise. I think they said 80% of the population, and so many children are now obese and or morbid obese or overweight. If you look back in history and you look back around on YouTube, especially if you search on YouTube and look at the people in the 1950s and the 1960s, our bodies have changed. They started changing in the late 1970s as far as larger frames, and I think that's when the fast food came in, right? So that's probably a correlation, but they say it doesn't have any correlation. So 30% of the population and 100 million people in USA have fatty liver disease. I think that it has been determined that fatty liver disease is usually caused by excessive weight. It could have an alcohol component, and that's usually the next stage after fatty liver disease. It goes into cirrhosis. And then the excessive carbs and sugar or fats. And what happens is, and it's pronounced NAFLD. A lot of people don't know that it's really caused by insulin resistance. Diabetes can cause a fatty liver. And medication sometimes can cause it also. So early detection is really important, usually by ultrasound. So if you do have it and you have a weight loss surgery, you might want to ask your surgeon before surgery, when he gets in there or she gets in there and your body habitus, what does your liver look like? Mine was okay. I didn't have a large liver, but that's amazing because I spent 7 years of obesity. To give you an idea what I look like, well, this is me as a kid. I wasn't an obese child. I was a normal weight child. I stayed out of obesity until I was my late 40s, early 50s. This was me in 2004. I was 44 years old. I wasn't obese. As a matter of fact, at the same time I met my husband, my second husband, I wasn't obese. I was maybe about 6 pounds overweight. I was always trying to lose 6 pounds or 10 pounds, and then I'd get it off, and then I'd gain it back. But I wasn't really an exerciser, but I really watched what I ate to keep my weight because I had a tendency in my family, I knew, to become obese. My brother had a weight problem. But then in 2005, it all blew up in my face, right? 2004, actually 2012 to 2011, my daughter said, "Mom, you're really getting fat." Yeah. Before I didn't realize it, right? I didn't look in my mirror. I wasn't really paying attention to what I ate. I was eating the SAD diet, or I don't know what you want to call it. Wasn't exercising because I was nesting and I was cooking and I had a sedentary job. Everything in my life had changed from this picture right here, right? So before I knew it, I was obese, right? My mom had a heart attack at 50. So, and I've been in the medical field for over 25 years. So I knew at 52, I would be approaching some long-term health consequences if I didn't get my act together quick. So my best friend at the time, she had weight loss surgery. So, and you can look back on my videos that says it. But yeah, I got up to a whopping 200 and over 200, and my highest recorded weight was 210 pounds. I had lost 5 pounds before I went to the doctors. My weight blew up and my legs were swollen because I have a very little body, right? I don't have a big body. I'm not big boned. I'm not, I have very short legs. I'm considered petite. These were, I used to be hourglass, and then I turned into a pear. And my legs were really thick. And then I lost approximately 65, got down to a normal BMI with a body fat between 15 and 20%. And I became normal, right? I became a triathlete. In 2014, I trained until I got hurt until late 2016. So yeah, this is me training for triathlons. So I consider myself a success with the lap band. That's my lowest, 147. I was quite gaunt. That was my lowest. I had lost most of my hair. Going vegan, did every body hack I could think of, because my weight loss surgery only worked for 3 months. I didn't have a metabolic reset, only maybe 15 pounds of that of 75. And then maybe it worked 3 months metabolically, and I paid about $7,000 out of my pocket for that. They're my normal legs. They're my normal legs. So yeah. So this is all about health for me now because I'm 58 years old. And I'm going to be 59 in December. So this is all about health. This is all about maintaining my body so that I can be a person who is possibly free from disease. There's no guarantee. And I don't want to get cancer, and I don't want to get the health consequences that are related to obesity. So that's what I do, my routine movement. I do as much as fitness as I can, and I really watch what I eat. I did a strict bariatric diet for 2 years, and ever since then, I've been released from my doctor. I don't have any medical insurance. I was 3 years to see a registered dietitian. I saw a registered dietitian at least twice a year for 3 years, right? And then I got discharged from the doctor. So I wanted to get back down to 130 pounds, but I never got to 130 pounds. I got to 147. So yeah, I was a little concerned when I went under the knife if I had fatty liver, but as it turned out, didn't. My mother had her gallbladder out when she was in her early 40s. Insulin resistant medications, metabolic syndrome, all relate to fatty liver disease, right? So I'm going to hook a couple cards that you might be interested in to just browse through. It might even be linked to PCOS and high intake of fructose, sugar. And I'm not much of a drinker. I only drink on occasion. I'm aware of cross addictions. I did have a little bit of shopping, a little bit of a problem there. I did, but now I live a so-called minimalist lifestyle because I became unemployed in June of 2017. So I don't work anymore. I'm living my best Zen life, and I'm working on my fitness. I'm constantly working on my mental, emotional state to keep that healthy too. So over here we got Dr. Eric Berg. He's a doctor of chiropractor. I like his channel, and I like the things that he says because he puts his YouTube channel in a non-scientific way, so layman's terms, people that are not in the healthcare.
Did a complete video on fatty liver, how to handle that. I'll put the link down below. But in this video, we're going to talk about 4 critical tips, okay? And these are the points to emphasize. These are the most important things. In fact, you got to realize if you have a fatty liver, it's not just that there's fat in the liver, it's dysfunctional. The liver cells are damaged, okay? And so we need to actually fix that. Number 1, okay?
So I just like to say that when the doctor goes in, he has to lift the liver up to get at your surgery, whatever type of surgery you have. He always has to, no matter what surgery you have, whether it's lap band, vertical sleeve gastrectomy, RNY, or the DS. And also, the blood test is not 100% accurate. It doesn't show up on a blood test until the liver is 90% damaged. The best way to do it is in a non-surgical way, is to get a liver ultrasound.
Organic. The food that you eat must be organic. Why? Primarily because we don't want the pesticide, insecticide, herbicide, fungicide, those type of things.
I've been eating mostly organic since 2000, the end of 2012, when I found out about it. I just heard this morning that kale is one of the most toxic vegetable that has the most pesticides on it. So they're cautioning you to be wary of that. You know, they always change things, right? The other night I heard about eggs. Eggs are poison now again. 5 years ago, eggs was the best thing. So I eat organic eggs. Most of my stuff is organic, free-ranged, wild caught, or farm raised.
That's right. But primarily, the most commonly used herbicide is glyphosate, which is the one they use in making GMO type foods. And it's in soy oil. It's in so many foods. So what we want to do is we want to make sure
oil, vegetable
we
oil.
don't keep putting back in that herbicide, that glyphosate, that GMO food.
I'm using avocado oil, but I don't use much oil on my food. Mainly it's used for my skin.
So that's one thing. We want to do organic because if it's organic, it doesn't have GMO. And we also want to detoxify the glyphosate and other chemicals from the liver. And there's a compound called glutathione, okay? And that's produced by the liver. It's also in certain vegetables. These vegetables will stimulate also the production of that compound to help.
Fermented vegetables, I mostly eat fermented vegetables now. And I also I pickle my own vegetables, my organic vegetables.
Break down the chemicals, and it's a sulfur-based compound, and garlic, onion, radish.
So yeah, so you can watch the rest. I hope you enjoyed this video. I always like to learn and listen to research videos and learn about health. It's real important because once the body starts breaking down, and it usually starts breaking down at 50. So thank you very much for your time, and see you next video.